Dr. Pratyush Ranjan. I'm consultant cataract and refractive surgeon and medical director ASG Super Speciality Eye Hospital, Varanasi, India. And this is the Cartwheel chop, which I usually teach to my fellows. So after capsulotomy, I try to do a hydro in which the nucleus is popped. And once this is popped, then under vision from the equator, you can draw a straight line to the center where the nucleus is impelled, and you chop this nucleus into pieces like this, and you do a supracapsular chop, but you do a emulsification in the back. The idea is like this, so that fellows, they don't have, young surgeons, they don't have such idea during the chopping, so they are safe. So that's how you do in a real life scenario. For experienced surgeon also, I think I'm using this for many of my hard cataracts. So this is how you do it in the real life scenario. You try to pull the nucleus up, and from equator you try to give a horizontal chop under vision, so that you're not disturbing the capsule, and you rotate and do multiple horizontal chops so that you sculpt the nucleus into various small manageable pieces, and then you push them into the bag again to start the emulsification process, which ideally should take place in the bag. So sometimes it's not possible because the pieces are big and they don't go easily. So that's how. So a hard white cataract is sculpted and emulsified like this. So another technique another video in which I have tried to explain this in a little slower version. So the phaco probe is impelled in the center, and one end is pulled out from horizontal. You try to under vision, so it's not a blind procedure. Mostly I teach my fellows to start from stop and chop, and from stop and chop to direct chop. In between you can use this cartwheel chop. So once you have mastered stop and chop, then going to direct chop is sometimes tricky. So in between that bridge is a cartwheel chop. So after making a trench, you just impel it deep enough so that it holds. Pull the nucleus one pole up and then chop. And once all nucleus is sculpted, OVD is injected to push nuclear pieces back to the capsular bag, and then you emulsify in the bag. So that makes nucleus management very easy, especially in hard cataracts. So this one is also a brown leathery cataract, difficult to manage, but very well managed by your cartwheel chop. I've been using this technique since last 6-7 years, and that was the time when I started teaching young fellows how to do phaco. So I understood their problem is, and that came as a technique to help them overcome their fears and learn this technique. So this emulsification is going on in the bag. You're little at not near the capsule, you are in mid bag or just at the pupillary plane level. So that makes you safe. And I have done more than approximately 30,000 surgeries with this technique. Absolutely flawless results, not much effect on endothelium. In fact, none. All my patients see very fine immediately after surgery, and next day they are absolutely very independent from that eye. Thank you very much for patiently watching this video. Thank you very much.